Hello, my name is Matt Kessler. I'm an Analytics Manager here at Bluetree Network. Today, I would like to give a brief demonstration of the reporting capabilities that Bluetree is able to offer regarding surgical suite operations reporting. To start, many know that surgeries and other procedures bring in a large amount of health system revenue. The challenge then becomes, how do we ensure that our processes for delivering procedural care are efficient without sacrificing patient care to minimize cost and improve our operating margins? This is where Bluetree comes in. We can help you set up a suite of reporting for your procedural suite and analyze areas which will yield the greatest return with process improvements. The following is a small piece of the overall procedural suite acceleration initiative here at Bluetree. We will focus on a few of the operational reporting metrics and visualizations that we would deploy at your organization in terms of surgery, but this could also translate to other procedural areas in your organization as well. Here on the screen is the first dashboard, which displays surgical volumes over time. We have overlaid the past 2 fiscal years as well as the current fiscal year to date. We then show how the organization is performing using a fiscal year to date % growth calculation so that we can see how you are tracking compared to the same time in the previous fiscal year. The other dashboards and metrics we will show here would likely help your volumes to increase, thus in turn increasing the surgical revenue. Some things to point out here is the fiscal year to date column that shows Bluetree Surgical Suite is at a negative 8% decrease in case volume from July of fiscal year 20 compared to the same time in July of fiscal year 19. Something else, you can also highlight over some of these points in time to see where these case volumes are to give you a tooltip. We also have the capabilities to build out more functionality as necessary to fit your reporting needs as you progress further in the initiative. To move on to the next dashboard is the percentage of scheduled first cases that begin on time each day. The calculations are based on the expected patient in room time for the first case in each OR compared to the actual in room times. What we're looking for here is a higher percentage of first cases that are starting on time. The more often a surgical suite can start the first cases of the day on time, the less it will affect downstream cases from being delayed. We also provide metrics for the total delayed minutes as well as the average delay minutes per case that month. This allows you to understand just how late some of these cases are starting on average. One additional thing we provided here is the cost associated with the minutes delayed. For this demonstration, we have done some research and assumed the cost per operating room minute is $60 per minute. If the percentage of cases that start on time is high, then this cost figure should be minimal. What we would aim to use this dashboard for would be to show how starting first cases on time would reduce the unnecessary cost of having an operating room up and running that is not being utilized. To ensure this metric is accurate for your organization, we would work with your organization to calculate what your current cost per operating room minute would be. A couple of things to note here on this. We can see currently as of July 20 of this year, Bluetree operating room is at 80% of first cases starting on time. With that being said, their total delay minutes for this month thus is about 6,000 minutes with an average delay per case of 47 minutes, which equates to about $360,000 in operating room costs that is being accrued to the room not being utilized. So far over this rolling 12 months, Bluetree OR has accumulated about $3.3 million of unnecessary costs for these first cases being started late. The next dashboard I want to cover here is the scheduling accuracy dashboard. This dashboard provides an overview of how accurate cases have been scheduled. This allows us to understand if there are certain surgical groups or providers that are better at predicting a case length than others. This data would be used to have a discussion on how we can better schedule to utilize block time more effectively. Ensuring that the schedule duration for the case is accurate is huge in making sure that cases do not run over, which in turn could push cases immediately following it later into the day. In combination with minimizing downstream delays, having accurate case scheduling to provide insight on where additional volume can be added to increase overall monthly surgical volumes and revenue is ideal. To look at here, this is a dual axis graph here. The line is showing the percentage of hours that were misposted, meaning that the actuals and the schedule do not match. The bars show the actual number of hours that were misposted. So right now for the month of July, we can see that the surgeons in Bluetree OR have misposted 377 hours, which equates to about a 14.6% misposted rate there, meaning that they are actually using more time than they're saying they're actually going to need. This could be an issue, like we just discussed, that it could push cases later in the day. It could even possibly cause ORs to have to cancel cases or postpone them to a later date because they do not fit anymore with all these downstream effects from inaccurately scheduling. The final dashboard that I want to provide is the turnover times dashboard. This one is not well built out. There's more that we could do with this, but for the sake of demonstrations, just wanted to give a high level overview of what we have the capability of doing. This goes along with scheduling accuracy. This metric shows how long it takes for a operating room to be turned over. So meaning a patient leaving an OR to another patient entering that same operating room for another surgery. Ideally, we would like to minimize the amount of time that this takes, but we also understand that some procedures inherently take longer on the cleanup. Example, a total knee replacement for an orthopedic surgery would take longer to clean and turn over a room compared to a cataract surgery from an ophthalmologist. This metric will help to get on additional cases that becomes more predictable, meaning that we can rein it in a little more. So what we're looking at here is a control chart. And what we want to understand here is how often are we in control and how often are we out of control of our turnover times, and how can we kind of dial that in a little more to be able to make it a little more predictable, to add that into our schedule breaks that will help with our scheduling accuracy as well as the split of time during the day for the surgical operating rooms here. One thing we did bake in here is a parameter that you're able to change. So right now, the upper and lower bounds are at 1 standard deviation away from the average. You can up it to 2 standard deviations. If we up it to 2, it looks pretty good. Everything seems to be within control. And then, of course, 3 standard deviations, everything is still in control here. This would be something we would want to dive further into with you and your organization to understand, if there's delays with turnover times. Most organizations, I believe, don't usually document turnover delays, but it would be a good practice to start doing to be able to understand how can we rein some of these turnover times in a little more. With that being said, the turnover time dashboard is our last visual for this demonstration. This was just a small piece of the reporting that Bluetree can offer, and an even smaller piece of the overall initiative that will help improve your margins for your surgical suite at your organization. If you're interested in learning more, please reach out to CS or the email on the screen for more information.